Each year, thousands of men live with hidden danger, that is prostate cancer. This condition often produces no symptoms in its early stages. The statistics are concerning. 1 in 8 men will face prostate cancer diagnosis in their lifetime. In the US alone, over 288,000 new cases were expected in the year 2023, and nearly 34,700 men were projected to die from the disease. If you don't know who I am, my name is Tom. I'm a biochemist. I make videos on prostate health every Monday and Friday. The good news is, when prostate cancer is detected early, the survival rate is around 98%. Therefore, knowing the early warning signs could be life-saving. So let's begin by looking at what is prostate cancer. Prostate cancer begins when the cells in the prostate gland starts to grow out of control. Prostate gland is located below the bladder and in front of the rectum, and its primary function is to produce some of the fluid that make up semen. Prostate cancer begins in the prostate gland, a small walnut-sized organ that produces seminal fluid. The disease can grow in two main ways. Now, the first way is slow growing and symptomless that causes little disruption for years. The second one is aggressive and fast growing, potentially reaching other organs and becoming life-threatening. So, understanding the early symptoms is crucial. Now, the first symptom is frequent urination, especially at night. This one is known as nocturia. An important question is, how does prostate cancer cause nocturia? Prostate cancer can cause nocturia in three main ways. So the first way is when tumor presses on or narrows the urethra. The second way is when cancer causes swelling or inflammation of the prostate. The third way is when the bladder becomes irritated or unable to empty fully. Now, this can lead to frequent urination, especially at night, weak urine stream, and feeling of incomplete emptying. Now, an important information for you to note is that nocturia is not an early sign of prostate cancer. Early prostate cancer rarely causes urinary symptoms. Most men with nocturia have non-cancerous causes such as benign prostatic hyperplasia, that is enlarged prostate, which I have already shared in the previous videos. Now, the second one is prostatitis or inflammation of the prostate. The third one is high blood sugar or diabetes. The fourth one is overactive bladder. Another cause is high evening fluid intake such as alcohol or caffeine, and it can also be caused by certain medications. Prostate cancer becomes more likely if nocturia comes together with other symptoms such as weak or slow urine stream, trouble starting urination, blood in urine or semen, pelvic or back pain, unexplained weight loss. Now, you need to see a doctor in case of the following. If you wake up 2 to 3 times nightly. Another reason you should see a doctor is if you have risk factors such as family history. That is, if a brother or a father have got symptoms of prostate cancer. Another reason why you should see a doctor is if you have risk factors such as age. If you are aged 50 plus and you are seeing those symptoms, you should see a doctor. Another risk factor is a family history where a father or a brother has already suffered from prostate cancer. And also, if you have an African ancestry, you should also see a doctor if you notice additional warnings. A simple PSA test or prostate exam can help to clarify the issue. The second sign of prostate cancer is painful ejaculation. Now let us look at how painful ejaculation can occur. The first way is through cancer-related inflammation. Prostate cancer can cause inflammation in and around the prostate gland. Since the prostate gland and the seminal vesicles are responsible for producing most of the semen, any inflammation here can make ejaculation painful. An individual may also experience painful ejaculation as a result of tumor pressing on nerves or ducts. As tumor grows, it may place pressure on the nerves and ducts that are responsible for sensation during ejaculation. This can lead to a sharp pain, burning or discomfort during or right after ejaculation. Painful ejaculation can also occur as a result of blockage of seminal pathways. A tumor can partially block the paths that carry semen. This can lead to build-up of pressure or pain during the moment of release. Painful ejaculation can also occur as a result of related conditions that mimic cancer symptoms. Even if cancer is not present, painful ejaculation can also be caused by inflammation of the prostate, benign prostatic hyperplasia, also known as PPH, pelvic floor muscle tension, STIs, and also recent medical procedures. These conditions are much more common than painful ejaculation caused by cancer. If you have tumor pressing on nerves or ducts, as tumor grows, it may put pressure on ejaculatory ducts and nerves responsible for sensation during ejaculation. This can lead to sharp pain, burning, or discomfort during or right after ejaculation. Another cause of painful ejaculation is blockage of seminal pathways. A tumor can partially block the ducts that carry semen. This can lead to buildup of pressure and number 2, pain during the time of release. The fourth reason you may have painful ejaculation is due to presence of conditions that mimic cancer symptoms. Even if cancer is not present, painful ejaculation can be caused by any of the following. So the first one is prostatitis, that is infection or inflammation, benign prostatic hyperplasia, that is BPH, pelvic floor muscle tension, and the fourth cause is STIs. It's also important to know that recent medical procedures can also cause painful ejaculation, that is including prostate biopsy. Now, these conditions are much more common than painful ejaculation caused by cancer. Now, the question is painful ejaculation an early sign of prostate cancer? The answer is no. Early-stage prostate cancer almost always has no symptoms. Painful ejaculation tends to appear only when, number 1, cancer is more advanced, number 2, there is significant inflammation in the prostate. Now, what are the symptoms that your seminal pathways are blocked as a result of cancer? You may notice one or more of the following. So the first one is painful ejaculation. Pressure builds behind the blockage causing burning or sharp pain. Another symptom is reduced semen volume. Less fluids are able to pass through the narrowed ducts. Another symptom is blood in semen, also known as hematospermia. Irritated tissues or vessels may bleed into semen. Another symptom is difficulty ejaculating or weak ejaculation. Some semen may not pass or may release with very low pressure. Another symptom is pelvic or perineal pain. Pressure in the prostate area can radiate to lower pelvic floor. An important point for you to note is that while these symptoms may appear in prostate cancer, they are by far more commonly caused by non-cancerous conditions. Examples of the non-cancerous conditions include prostatitis, that is inflammation of the prostate, BPH, that is enlarged prostate, ejaculatory duct obstruction from cysts or stones. Cancer-related conditions may happen, that is during moderate to advanced stages, not early cancer. Now, when are you supposed to seek medical advice? Number 1 is due to repeated painful ejaculation. Number 2 is noticeable drop in semen volume. Number 3 is blood in semen. Number 4 is pelvic or groin discomfort. Another one is urinary problems combined with sexual symptoms. Now, a urologist can evaluate this with a PSA test, prostate exam, ultrasound, or MRI if needed. Painful ejaculation can also occur as a result of related conditions mimicking cancer symptoms. Even if cancer is not present, painful ejaculation may be caused by the following factors. So the first one is prostatitis, that is infection or inflammation of the prostate. The second one is benign prostatic hypertrophy or hyperplasia, that is enlargement of the prostate. The third one is pelvic floor muscle tension. The fourth one is STIs, and the fifth one is recent medical procedures, including prostate biopsy. It is important for you to note that these conditions are much more common than painful ejaculation that is caused by prostate cancer. You need to see a doctor if this happens repeatedly, if it occurs together with urinary problems, if it comes with blood, if it occurs with blood in semen or urine, if it's also accompanied by pelvic or lower back pain. Another symptom of prostate cancer is blood in urine or semen. So let us look at how prostate cancer causes blood in urine or semen. So the first way is through tumor growth. As tumor grows, it may press on the urethra, partially blocking urine flow. This can lead to symptoms such as frequent urination and eventually bleeding. The second way is through vascular damage. Tumors can damage blood vessels in the prostate. This may lead to blood slipping into the urine or semen. Another way is through metastasis. When cancer spreads to other parts of the body, it can cause a range of symptoms including blood in urine or semen. Other causes of blood in urine or semen include prostatitis, refers to the inflammation or infection of the prostate gland. Another one is benign prostatic hyperplasia or BPH. An enlarged prostate may cause blood in the urine. Kidney stones can actually lead to bleeding, and therefore that may cause the blood to appear in urine or semen. Also, infection can lead to appearance of blood in urine or semen. Other cancers can cause appearance of blood in urine or semen. An example is bladder cancer, which is the common cause of appearance of blood in urine or semen. Now, here are important points for you to consider. If you see blood in urine or semen, it is important for you to consult your doctor for proper diagnosis. Blood can be a sign of many conditions, and it is important to rule out other conditions such as cancer or infections. Prostate cancer can also have no symptoms at all, especially during its early stages of development. Now, a doctor can check for it using a prostate-specific antigen, that is PSA test. Blood test or other screenings may also be done. You should get checked if you notice blood in urine or semen even at once, in case you are aged 45 years and above, in case it keeps recurring, if you have other symptoms like difficulty urinating, pelvic pain, weak urine flow, or unexplained weight loss. The fourth symptom of prostate cancer is pain while sitting. Let us see the reasons why pain while sitting can happen in prostate cancer. So the first reason is tumor pressing downwards, nerve around the prostate and also the rectal area. Now, when you sit, the body weight exerts pressure on this particular region. This causes deep pelvic, perineal, or groin pain. Another reason you may have pain while sitting is inflammation inside the prostate. Cancer may cause internal inflammation of the prostate tissue, surrounding nerves, and also pelvic floor. Inflamed tissue may become more sensitive. Pressure from sitting may trigger discomfort or pain. Is pain while sitting an early sign of prostate cancer? The answer is no. Early prostate cancer is always silent. Pain while sitting typically occurs when the tumor is larger, there is significant inflammation, or cancer has spread beyond the prostate. Here are the most causes of pain while sitting that are non-cancerous. So the first one is prostatitis, means inflammation of the prostate. The second one is BPH, that is an enlarged prostate. Another one is pelvic floor tension, and the fourth one is pudendal nerve irritation. In addition, tailbone or pelvic muscle disorders can actually cause pain while sitting. These conditions are much more common than cancer. So, when are you supposed to see a doctor? You need to seek evaluation if pain while sitting is deep in the pelvis or between the testicles and anus. You can also see the doctor if pain while sitting persists for weeks or is accompanied with persistent urinary symptoms. You may also want to see the doctor if pain while sitting is accompanied by blood, or a PSA test or a prostate exam can actually help us to identify the cause. The fifth sign that one may have prostate cancer is pain in the back, chest, or hips. Let us see the reasons why prostate cancer may cause pain in the back, hips, or chest. The first reason why prostate cancer may cause pain in the back, hips, or chest is prostate cancer commonly spreads to the bones. Prostate cancer has a higher tendency to spread. Now, the spreading of cancer is known as metastasis. Prostate cancer may spread to bones, especially lower back, hips and pelvis, ribs, and also chest bones. When cancer cells reach these bones, they spread inflammation, structural weakness, and pressure on nerves. Now, this leads to deep etching or persistent pain. Another reason why patients suffering from prostate cancer normally experience hips, back, or chest pain is tumor growth puts pressure on spinal nerves. This may cause lower back pain, sciatica-like pain radiating to the hips or legs. Now, another cause of pain in the hips, chest, or back is bone lesions often cause pain and fragility. Cancer inside a bone causes bone lesions, which may in turn lead to weaknesses in the affected area. This leads to constant dull pain during walking or standing and higher risk of fractures. Pain in the hip or pelvic bone is especially common because prostate commonly sits close to the pelvic skeleton. The fourth reason is chest or rib pain. If prostate cancer spreads to the upper ribs or upper spine, it can cause sharp rib pain, chest discomfort, or pain when breathing deeply. This may be caused by things such as bone irritation, nerve pressure, or inflammation around the ribs. Now, is back, hip, or chest pain an early sign of prostate cancer? The answer is no. This type of signs normally appear later when cancer has grown beyond the prostate. Early stage prostate cancer almost always has no symptoms. Now, how does the pain in the chest, back, or ribs feel like? Men with bone-related prostate cancer often report deep, dull itching pain that does not improve with rest, pain that is worse at night, pain that is radiating from the back, pain that is radiating from the spines to hips or legs, ribs or chest pain when moving or coughing. Now, when are you supposed to seek medical help? If you have persistent back or hip pain for weeks, pain that gets worse instead of getting better, bone pain plus urinary symptoms, unexplained weight loss or fatigue, a high history of PSA or prostate issues, a doctor may check PSA levels, imaging scans, or bone tests. The sixth sign of prostate cancer is swelling in legs or feet. Swelling in the legs or feet can be a sign of prostate cancer, especially in a more advanced cases. This happens because prostate cancer can interfere with the normal body circulation in addition to drainage system in a few key ways. One of the reasons the patient may have swelling of legs or feet is because of the blockage of lymphatic drainage. Now, the main function of the lymphatic system is to drain fluids from tissues. This happens especially in the lower parts of the body, where the fluid is drained back into the bloodstream. If cancer spreads to the lymph nodes in the pelvis or the abdomen, it can block lymph flow, causing the buildup of fluids in the legs. Now, this result is known as lymphedema. Lymphedema is usually firm, and sometimes it is a painful swelling in the legs. Another reason one may experience swelling in the legs or limbs is compression of pelvic veins. A growing prostate tumor or enlarged lymph nodes can press against major veins in the pelvis, such as iliac or veins. Now, this reduces blood return from the legs. Swelling in the legs or limbs may also be caused as a result of cancer treatment side effects. Sometimes swelling may not come from the cancer itself, but from treatment such as, number one is surgery, especially if the pelvic lymph nodes were removed. Number two is radiation therapy, which can scar lymphatic vessels. The third one is hormone therapy, which can cause fluid retention in some men. Another cause of swelling in the legs or limbs include blood clots, that is DVT. Advanced prostate cancer increases the risk of deep vein thrombosis. This may be due to immobility, cancer-related blood clotting changes, and hormone therapy. A clot in the leg can cause sudden swelling, pain, and redness. Now, when does leg swelling become concerning? The first way is when it is persistent or progressive, or if it occurs in both legs, if it is accompanied by pelvic pain, back pain, or urinary symptoms, in addition to unexplained weight loss, when it occurs during or after prostate cancer treatment. Now, here is an important point for you to note. Leg swelling is not usually an important sign of prostate cancer. Many benign conditions, heart failure, kidney diseases, venous insufficiency, medications can also cause swelling. Now, the number 7 sign of prostate cancer is unintentional weight loss. Losing weight without trying can be a serious red flag. Cancer cells use up the body's energy supply, creating a metabolic imbalance that leads to rapid weight loss. Unlike intentional weight loss, this type normally leaves one tired even if they eat normally. The number 8 sign of prostate cancer is numbness or weakness in the limbs or legs. Tingling, numbness or weakness in the arms or legs may indicate advanced prostate cancer pressing on the spinal cord. This condition, known as spinal cord compression, often interferes with the nerves that are responsible for sensation and movement. Without treatment, it can lead to paralysis or a loss of bowel and bladder control. What are the risk factors for prostate cancer? Age. The risk of prostate cancer goes up with age. Prostate cancer is most commonly after age 50. Another risk factor is ethnicity. For example, researchers have found that in the United States, People with higher risk of prostate cancer includes African American people. Now, healthcare professionals are not sure why this happens. In black people, prostate cancer is also more likely to grow faster. Another risk factor is family history of prostate cancer. If a close relative, such as your brother, your close cousin, or your father has been diagnosed with prostate cancer, your risk may be increased. Now, another risk factor is family history of DNA changes. DNA changes such as BRCA1 and BRCA2 can cause higher risk of prostate cancer. These DNA changes are best known for increasing the risk of breast cancer and ovarian cancer. Another risk factor is obesity. People who have obesity have a higher risk of prostate cancer compared to people considered to have a healthy weight. However, studies of this issue have had mixed results. In people with obesity, prostate cancer is more likely to grow quickly and is more likely to come back after treatment. Another risk factor of prostate cancer is smoking tobacco. Some research shows a link between prostate and smoking tobacco, but not all studies agree. People with prostate cancer who smoke have a higher risk of prostate cancer coming back after treatment. People with prostate cancer who smoke also have a higher risk of prostate cancer spreading to other parts of the body. Complications of prostate cancer and its treatments include: number 1 is cancer that spreads. Prostate cancer can spread to other parts of the body, including bones or other organs. When prostate cancer spreads, this condition is known as metastatic prostate cancer. Another complication of prostate cancer is incontinence. Prostate cancer and its treatment can cause leaking of urine. Now, this one is known as urinary incontinence. I have already shared it in other videos. Another complication of prostate cancer is erectile dysfunction. Erectile dysfunction refers to the difficulty getting erection. Erectile dysfunction can be caused by prostate cancer or its treatments. Next, let us look at the prevention of prostate cancer. You need to know that there is no sure way we can prevent prostate cancer. Now, you can help to reduce the risk of prostate cancer if you, number 1, choose healthy diet. Eat a variety of fruits, vegetables, and whole grains. Limit the amount of animal fats that you eat. Fruits and vegetables contain many vitamins, and nutrients can do good to your health. Foods that have been linked to lower risk of prostate cancer include tomatoes, broccoli, red cabbage, cauliflower, and soy. Now, no studies have proved that these foods can prevent cancer. If you already are eating these foods, there might be an added advantage of adding them in your diet. Another way we can prevent the risk of prostate cancer is regular exercises. You need to exercise most days of the week. Although it is not clear if exercises can prevent prostate cancer, it may help you to maintain a healthy weight. Exercise may also help to improve your overall health and also your mood. Now, if you are new to exercises, talk to your healthcare provider about it. You can start slow and work your way up to more exercise time each day. Another way we can improve on the risk factors is by maintaining healthy weight. If your current weight is healthy, work to maintain it. Choose a healthy diet and exercise most of the days of the week. If you need to lose weight, add more exercises and eat less calories per week. Another way we can reduce the risk factor of prostate cancer is by avoiding smoking. If you don't smoke, don't start. If you already smoke, talk to your healthcare provider to help you what might assist you to quit. Medicines, nicotine replacement products, and counseling may also help. Now, we can also use medicines to lower the risk of prostate cancer. If you have a higher risk of prostate cancer, you and your healthcare professional may consider medicines to lower the risk. These medicines may include finasteride, that is Propecia Prosca, and dutasteride. I have already talked about finasteride. They are most often used to treat prostate gland enlargement. Now, ask your healthcare professional to talk about benefits and the risk of using this medication. When prostate cancer happens to people using these medicines, it tends to grow faster. Your healthcare professional can help to explain your risk and whether these medicines are right for you. Thank you for watching. If you have liked this video, don't forget to like and also subscribe. Thank you.